Clinical research suggests that one of the biggest reasons prostate enlargement keeps getting worse for men over 40 is not what most people think. The common belief is that it is simply old age, or that nothing can really be done except medication or surgery later on. But when researchers actually look deeper into prostate tissue, hormone signaling, inflammation markers, and metabolic changes, a different picture starts to appear. What they consistently see is that the prostate does not enlarge randomly. It responds to signals in the body, and many of those signals are driven by modern lifestyle patterns that were never part of human biology for most of history. Medical experts say the prostate is extremely sensitive to chronic low-grade inflammation, insulin resistance, stress hormones, and changes in how testosterone is converted inside prostate cells. When these factors are present for years, the prostate is basically being told to grow and thicken, even if total testosterone levels look normal on basic blood tests. What surprises many men is that this growth is not always about having too much testosterone. In fact, clinical research suggests that one of the real drivers is how testosterone is converted into a stronger hormone inside prostate tissue. This conversion process becomes more active with age, higher body fat, and chronic inflammation. When that happens, prostate cells receive stronger growth signals, even if a man does not feel particularly high testosterone overall. This is one reason why two men of the same age can have completely different prostate sizes and symptoms. One may urinate normally and sleep through the night, while the other wakes up multiple times, feels pressure, and struggles with weak flow. The difference is not just genetics. It is often the internal hormonal environment and inflammation load that has been building quietly for years. Medical experts also point out that many traditional explanations ignore the role of blood sugar and insulin. Clinical research suggests that men with higher fasting insulin or pre-diabetic patterns tend to have more aggressive prostate enlargement over time. Insulin is a growth-promoting hormone, and when it stays elevated, it does not only affect fat storage or diabetes risk, it also sends growth signals to tissues like the prostate. Over years, this creates a slow, silent push toward enlargement. This means that what a man eats, how often he spikes his blood sugar, and how sensitive his cells are to insulin can directly influence prostate size and urinary symptoms, even if no one ever mentions this connection in a quick doctor visit. Another overlooked factor is chronic pelvic and systemic inflammation. Clinical research suggests that low-grade inflammation can make prostate tissue more reactive and more likely to swell and grow. This inflammation does not always come from infections. It often comes from gut health issues, food sensitivities, poor sleep, high stress, and long-term exposure to inflammatory diets. Over time, this creates a background inflammatory state where prostate cells behave as if they are under constant irritation. When that happens, even small hormonal shifts can trigger more growth than they normally would. This is one reason why some men notice their symptoms get worse during periods of high stress, poor sleep, or weight gain, even if nothing else seems to change. Clinical research also suggests that many men are never told how much daily habits shape prostate signaling. Sitting for long periods, low physical activity, and poor circulation in the pelvic region can reduce healthy blood flow and lymphatic drainage. This can trap inflammatory compounds in the area and reduce the delivery of oxygen and nutrients that help tissues regulate themselves properly. Over time, this creates an environment where the prostate becomes more prone to congestion and enlargement. Medical experts say this does not mean intense exercise is required. Even regular walking, light strength training, and simple movement patterns can significantly improve pelvic circulation and help normalize some of these signals. Another major piece that is often misunderstood is stress biology. Clinical research suggests that chronic stress elevates cortisol and other stress hormones, which can indirectly disrupt testosterone balance, worsen insulin sensitivity, and increase systemic inflammation. All of these pathways feed directly into prostate growth signaling. This means that prostate enlargement is not only a physical issue, it is also deeply connected to how the nervous system and stress response have been operating for years. Men who live in a constant state of pressure, poor sleep, and mental overload may unknowingly be creating an internal environment that pushes prostate tissue toward enlargement. What makes this especially important is that these drivers are not fixed. Clinical research suggests that when men improve insulin sensitivity, reduce chronic inflammation, improve sleep quality, manage stress, and support healthier hormone signaling, prostate growth signals can slow down significantly. In some cases, symptom severity can improve even if the prostate size itself does not dramatically shrink on imaging. This is important because symptoms are often driven not just by size, but by inflammation, muscle tone, and pressure dynamics in the bladder and prostate region. That means meaningful relief is possible even without drastic medical intervention for many men. Medical experts also emphasize that focusing only on medications without addressing these deeper causes is like putting a temporary patch on a system-wide problem. While medications can help relax muscles or reduce certain hormone conversions, they do not fix insulin resistance, chronic inflammation, or stress biology. Clinical research suggests that men who combine medical care with lifestyle and metabolic improvements tend to have better long-term symptom control and a slower progression of enlargement. This does not mean abandoning medical advice. It means understanding that prostate health is not isolated. It reflects the overall internal environment of the body. Over time, this perspective can completely change how a man thinks about prostate enlargement. Instead of seeing it as an unavoidable part of aging, it becomes something that is influenced by daily signals, habits, and internal chemistry. Clinical research suggests that when those signals are shifted in a healthier direction, the prostate often responds in a healthier way as well. That is why focusing only on the prostate misses the bigger picture. The real cause is often a long-term pattern of metabolic, inflammatory, and hormonal signals that have been quietly building for years. When men understand this, it can be empowering instead of frightening. Medical experts say that even small changes, when done consistently, can shift these internal signals over time. Better blood sugar control, reduced inflammatory load, improved sleep, regular movement, and stress management all send different messages to prostate tissue. Instead of being told to grow and swell, the prostate starts receiving signals to stabilize and calm down. This is why some men notice gradual improvement in nighttime urination, pressure, and flow when they address these deeper drivers, even before any dramatic changes show up on scans or lab tests. The key takeaway from clinical research is that prostate enlargement is not just a local issue. It is a reflection of the body's overall internal environment. When that environment is inflamed, insulin-resistant, stressed, and hormonally imbalanced, the prostate tends to follow that pattern. When that environment becomes calmer, more metabolically healthy, and better regulated, the prostate often follows in that direction too. That is why understanding the real cause is so important. It shifts the focus from fear and inevitability to awareness and long-term control. And for many men, that shift alone is the first step toward regaining confidence, comfort, and a sense that prostate health is something that can be actively supported rather than passively endured. Clinical research suggests that for many men, the hardest part about prostate problems is not just the physical symptoms. It is the quiet fear that comes with them. The fear of getting older faster than expected. The fear of losing control over simple things like sleep, comfort, and confidence. The fear of waking up at night and wondering if this is just how life is going to be from now on. Medical experts say these thoughts are extremely common, even if men rarely talk about them out loud. And that silence is often what makes the problem feel bigger and more overwhelming than it actually has to be. What most men are never told is that prostate changes are not a sudden event. They are the result of years of signals inside the body. Signals from inflammation, stress, blood sugar, hormone conversion, and daily habits. And the powerful truth is this: the same system that slowly pushed the prostate in the wrong direction can also be guided back toward balance. Clinical research suggests that when those internal signals change, the body does not just give up. It listens, it adapts, and over time, it responds in ways that many men never thought were possible after 40, 50, or even 60. Medical experts say this is where hope becomes real, not just motivational, because hope here is based on biology. It is based on how cells actually behave when the environment around them becomes calmer, less inflamed, and more metabolically stable. This means that every better night of sleep, every reduction in chronic stress, every improvement in blood sugar control, and every step toward reducing inflammation is not too small. Each one is a message to the body, a message that says, you are safe to stabilize, you are safe to heal, you are safe to stop overreacting. For many men, the moment that truly changes everything is realizing that prostate health is not about punishment or blame. It is not about something being wrong with you. Medical experts emphasize that it is about understanding how the modern world has quietly pushed the body into patterns. It was never designed for long sitting, chronic stress, Processed foods, poor sleep, and constant pressure on the nervous system all add up. When you see it that way, prostate symptoms stop feeling like a personal failure. They become a signal that the body is asking for a different kind of support. Clinical research suggests that men who take this perspective often regain more than just urinary comfort. They regain a sense of control, a sense that their body is not betraying them, but communicating with them. That shift alone can change how a man sees aging. Instead of seeing it as a steady decline, he begins to see it as a phase that still allows for strength, clarity, and self-respect. Medical experts say that mindset matters because it changes consistency, and consistency is what turns small changes into meaningful long-term results. If you are watching this and you have felt frustrated, embarrassed, or even quietly worried about your prostate, know this: you are not alone. Millions of men experience the same fears, the same nighttime interruptions, the same doubts about what the future holds. But clinical research suggests that the future is not written yet. The prostate is not a fixed destiny. It is a responsive organ in a responsive body. And when the body receives better signals, it often gives better outcomes. Medical experts say the most important step is not perfection. It is awareness and direction. Once you understand what truly drives prostate enlargement, you stop chasing random quick fixes. You start building a system that supports your body at a deeper level. Over time, that system becomes stronger than fear, stronger than confusion, stronger than the idea that this is just how it is now. And that is the real message here. Prostate health is not just about a gland. It is about quality of life. It is about sleeping through the night. It is about feeling confident when you leave the house. It is about knowing that your body is still capable of responding when you give it the right environment. Clinical research suggests that when men commit to that process, they often discover something powerful. Aging does not have to mean giving up control. It can mean gaining understanding. So if this video helped you see prostate health differently, remember this: the body is not against you. It is waiting for better signals. And when you start sending them, consistently and patiently, the body often answers back. That is not hype. That is biology. And for many men, that realization becomes the turning point, not just for prostate comfort, but for how they approach their health for the rest of their life.